Welcome back to Ethnic Health America. In this segment, we're going to talk with psychologist Dr. Vernita Marsh. She is a general psychologist with a number of different specialties. Dr. Marsh, thank you for taking the time to join us.
Thank you for having me.
You know, one of the biggest problems that is seen in most medical practices and most psychology practices is depression. I think one of the biggest challenges is that sometimes people have depression and they don't know that they have it. What are some of the things that you see people present most often with?
Often people who have depression present with neurovegetative signs, which simply are like lack of sleep, lack of appetite, or actually changes in their appetite. It could be that they're eating a lot, lack of energy, loss of concentration, even can affect their libido, lack of libido. Even the things that you once found that you used to have pleasure, you don't even enjoy them anymore.
Now, when you see a person like that, how are you able to separate out depression from some of the other common disorders that you deal with?
Good question. So part of what I'd like to talk about, if I may, Dr. Lenore, is that there's two major types of depression, and that's what we call major depression and dysthymia. And often with major depression, actually it needs to last, in terms of the symptoms, at least for a period of 2 weeks. And then with dysthymia, you have at least for 2 years, and that's an often illness that people don't recognize because they can go to work, they can function, but they really don't have the pizzazz in life. And it's just they're going on a low-grade operation.
So the depression is kind of even difficult for even some of their most closest friends and relatives to recognize.
Absolutely.
What, and how do you separate out? I mean, how do you extract from them? I mean, does it take a critical event before that kind of depression is recognized, or these people that you see in counseling and just you recognize it because of your expertise?
Sure. So one of the things I think that's real important is that if you notice that there have been some significant changes in your life, for example, grief, you lost someone and you start to feel very sad. But what happens often is that the sadness ends up becoming very debilitating, where you can't function anymore and it lasts for a longer period of time. Then you're more likely are depressed, that grief reaction has turned into depression, and that you need some help to deal with that.
Now you were trained in Michigan State and in Boston, had several excellent East Coast places. Is depression more common when the weather is bad, or for instance in California here when it rains? Does that bring out more depression, or is that a myth?
Actually, there is some truth to that. You're referring to what we call seasonal affective disorder, and during dark times, or during cloudy weather, or even during cold times. For example, Lansing, Michigan, in which I studied, is considered one of the cities that is more gray, and there was a high prevalence of depression in that area.
In Seattle, there's a similar reputation. Now, there's always waging this argument about the treatment of depression. And you know, there's the medical group, the medicines, then there's the therapeutic group for more of the kind of didactic intervention. Where do you weigh in on that?
Well, I actually weigh on what the research says, and what the research suggests is that for anywhere from someone who has mild to moderate depression, even to someone who has severe depression, that, and actually there's even increasing studies with respect to this, is that actually being able to talk about it changes even the map in your brain. With combination in terms of if it's moderate to severe depression, a combination of antidepressants and psychotherapy.
Do you find when you see patients with depression that they've often gotten to the point where they thought there was no hope to be better?
Absolutely. Hopelessness is actually one of the symptoms of depression. In fact, When there's hopelessness, that's often a sign of a much more severe depression, which tends to fall in the category of major depression.
And do you think that depression is recognized in the African American community as it should be near the statistics?
No, I think it's often underdiagnosed. And I think it's for a couple of reasons. I think one is due to the stigma within the African American community. Depressed? Oh no, can't be depressed. But also, I think
It's got to be the blues.
you're right. It has to be the blues or something else. Or it's the lack of access to mental health services that tends to be a luxury for many people of color, namely African Americans. So,
Well, Dr. Vernita Marsh, thank you for taking the time from what I know is a very busy schedule to join us.
thank you.
All right, we'll be right back after this break.